Rathdown is a county located in the south side of Dublin with a population of almost 220,000 people, 30% of whom are children and young people. The Department of Children and Youth Affairs has requested that TUSLA develop an interagency structure known as a CYPSC in every county in Ireland. So as part of my role as Area Manager in Dublin South, South East and Wicklow, I chair this new interagency structure, which has senior management representation from key services supporting children and young people in the county. I'd like to thank all of the statutory, voluntary and community services for their continued commitment to the interagency strategic planning process, and I look forward to working with them to implement the 3-year plan. Thank you to the children and young people who took part in consultations, and thank you to Laoghaire, CYPSC Coordinator, for her hard work in driving and managing the development of the CYPSC and its substructures, and for the CYPSC projects delivered to date. Let's hear from Laoghaire how the plan was developed.
Hello, my name is Laoghaire and it's been my privilege on behalf of the Department of Children and Youth Affairs and TUSLA Child and Family Agency to develop the county plan for Dún Laoghaire Rathdown for children and young people in collaboration with multiple stakeholders and of course in collaboration with young people themselves. So this county plan we're particularly excited by because it's our first interagency county plan and it's underpinned by a robust evidence baseline informed both by rigorous quantitative data sets compiled for us by the All-Ireland Research Observatory and equally and more importantly perhaps informed by the lived experience of children and young people in the county as well as by the service expertise of practitioners working directly with children and young people. So we hope that you do get the opportunity to read the plan. It is available online for download and that's on www.cypsc.ie. Before we hear directly from the services and the young people involved, I just want to assure people that this plan is a sustainable plan because we have set up structures, subgroup structures and a strategic area management structure that you've heard the TUSLA area manager speak about. Each one of these subgroups has representatives from over 20 different services and there are 6 different subgroups. They align to each of the Better Outcomes, Brighter Futures national outcomes for the entire population. So those are in general that we would improve outcomes for children's safety and well-being, for their health and mental health, for their education and learning, for their economic participation and well-being, and for their sense of belonging and feeling connected and respected in their communities. So I would just like to take this opportunity to thank all of those leaders, those champions for children, and let's hear from some of those leaders now, and of course let's hear from some of the young people involved.
The overall aim of the health and mental health subgroup is to harness our collective energy and passion and resources in developing projects across agencies to enhance the health and mental health and well-being of young children and young people in the area. Through building bridges across services and enhancing our communication among ourselves and to children and young people. We hope to be doing that better as a result, but also we have identified a couple of key areas in listening to children and young people and their parents talk about where the gaps were or what they felt that would be particularly valuable. So on foot of that, we have a couple of key target areas over the coming years, and they are around enhancing the provision of early intervention and particularly infant mental health service provision in the area. We also have been keen to target children and young people, particularly adolescents, who for a variety of reasons may find it difficult to access or stay engaged with mainstream education or social activities. We also built on existing service provision in the area in relation to supporting children and young people who may be quite marginalised or living in difficult circumstances.
The project has been here for over 20 years and just recognising the need for collaboration and identifying some of the gaps that are in the area, and I suppose CYPSC is part of that, and one of the big things was the infant mental health and supporting young people and bringing programmes into the area, and I suppose we did that through collaboration and being on the groups, attending some of the subgroups, particularly around infant mental health, and we did some training around that.
The reflective practice group has been a really interesting piece of working together because the HSE psychologists would say to us they would work very particularly with families in a particular way over a certain amount of time, but they would say we have a niche to be able to, for them to send their parents and infants to us in the community-based parent and infant groups. But I think there's something about a strategy and a way forward, and money and funding for because again, Dún Laoghaire Rathdown is obviously seen as an affluent county, whereas that's not true everywhere. It's absolutely not true everywhere, and a lot of parents, and I mean, when I think of the parents haven't valued the supports they've got, I think that all feeds into each of our organisations at a local level, to me then the CYPSC at a county level, and then international structures.
We received funding for to set up a physical activity hub in a disadvantaged area, and Laoghaire was kind of designated as a disadvantaged area. In 2018 we had just kind of started to get things really moving, and we then had to make contact and find out what people wanted in the area. This is where CYPSC was a bit of a lifesaver for us, that in fairness they came in and helped us set up and funded a research program that we were doing to see what people wanted in the area, what were the needs of the children, and how could we facilitate getting people engaged in that. Without anybody else, we couldn't do our job. So we needed the Family Resource Centre, Cross Care, the likes of the Leisure Centre, the schools. I'm probably leaving out a few more, but anybody that had a vested interest in children and getting them active and engaging with them.
UCD is pleased to co-chair the Education and Learning subgroup of the Dún Laoghaire Rathdown Children and Young People Services Committee, and we do this with the Dublin Dún Laoghaire Education Training Board. We first started meeting as a group in the Marina Hotel in Dún Laoghaire, I think it was March 2017. And from that emerged an interagency working group with representation from early years services, primary and post-primary schools, the Education Training Board of course, further education institutes and higher education institutes such as UCD and IADT. The great thing about this interagency working group is that there's a huge breadth of service knowledge, and the members' expertise is reflected in the subgroup's plan. And it deals with all ages and all circumstances. In particular, it addresses educational inequality and specific underserved populations. The group appreciate that social, emotional intelligence and relational well-being is critical to the success of children and young people in educational contexts as well as in life. So we plan to work with a range of services to implement evidence-informed programs that will support social, emotional skills, healthy relationships and cyber education.
We got involved with our CYPSC, our local CYPSC, to, as part of their education subgroup, to really establish what the priorities would be for education in terms of the plan moving forward. And online safety, it was clear, was a priority issue, and it came up in those early discussions and in those early consultations that we collectively had as a group. And it became evident that it would be useful to do some further research on kind of what the ideal interventions would be and where resources should be invested. So we got involved with CYPSC and UCD on doing a kind of joint research project. So it was a really useful project, and what's great is hopefully it will also help to establish, where future interventions should go in terms of online safety.
The Junior Reach programme is a programme that's being piloted at the moment, and it's targeted at young people who have been disengaged from school because of mental health reasons. The idea with the programme is to try and get people back into school. It's a kind of a graded approach of trying to reintroduce them to help them overcome their anxieties or any other issues that are stopping them from getting into school. The programme came about after a CYPSC consultation with all of the stakeholders in the area, and it's sort of covering the Dún Laoghaire Rathdown area. And I think that out of that consultation came identification of different groups that weren't being served at the moment. There was no targeted service for them, and one of these groups were young people disengaged for mental health reasons from education. And without the CYPSC involvement, those services wouldn't necessarily have come together on this, not for different reasons. I think that one of them though as well is the perspective. So we don't necessarily see where the gaps are until we pull everything together.
The Dún Laoghaire Rathdown CYPSC Parenting Support Subgroup is bringing together all of those working with parents in the area, and the idea behind it, I suppose, is really to look at the needs that parents have in Dún Laoghaire Rathdown, to work with those who are working with the parents in helping, I suppose, a strategic plan in relation to responding to parents and offering people working with parents the opportunity to develop their skills. We hope to bring in kind of more evidence-based programs and offer training opportunities and opportunities for collaborative work in the county, so that we hope that we will be meeting the needs of the parents. And one of the things we're going to do initially is really do an assessment of the needs of parents and also of providers and see what the gaps are, and then work towards a plan around filling those gaps with our partners. And I think the challenge for us in Dún Laoghaire Rathdown is that it's perceived to be, well, it is a very affluent area, but there are really, pockets of, quite intense deprivation. It's not just about economic deprivation, but there's lots of families that struggle in lots of different ways, and sometimes it's actually very hard for families to look for support.
It's of critical importance that we work together when we're working with parents. There are a range of services across Dún Laoghaire Rathdown. In coming together to collaborate, particularly in terms of mapping what's available, but also in terms of what we provide, is to ensure that we maximise the potential to reach out and to respond to parents across the area. We avoid duplication, and we have a shared understanding of what the needs of children are, what the needs of parents are, but also how we can collectively respond in a collaborative and integrated manner to the needs of parents across the area. Working together is absolutely pivotal, but also much more effective and efficient.
Here in Ballyogan, we kind of identified that there were a lot of new mums and new parents, so we were able to adapt the programme into the Healthy Happy Parent and Baby programme. So we incorporated baby massage and yoga. We had a midwife, which was great, so she was really good at offering really practical and kind of useful and trusted advice to the parents. It's been a wonderful programme to be involved in, I have to say. From that initial pilot, we've run 2 more full sessions and then some additional sessions as well. Having a baby is a real kind of shock to your system. It really does kind of, your life is changed forever. And just having that support there, I think, has helped the parents to kind of go through that whole process.
The interagency work is really, really valuable. Being able to access the services, know the people behind the services, at the top of the services, that you can go straight to somebody who can point you in the right direction and will know who to go to. Because that can be hard for us sometimes when we're on the ground. And it's about developing them relationships and just knowing the people.
CYPSC came here about 2 years ago at that time. We done the course. I was a bit sceptical about it because there's that many people coming and going about trying to include travellers in policies, and then they disappear, they're off the radar. They get our information and then they're gone. It's parked up and it's put in the file. In fairness, the CYPSC team, you've always kept an engagement. You've done it in such a way. We had the young people there. As I said, I was a bit sceptical at first because I was like, I want to get all my opinions again, nothing's going to come out of it. But you set up other things that the young parents wanted to do. You've constantly engaged with us. You're making sure that just different ones from the organisation, sitting on different various little wheels of your little CYPSC agencies.
With the baby yoga or the baby massage, and it was very good and it was very successful. Like, it helps mental health, especially with postpartum depression. Like, a lot of new mums don't have anyone to talk to. They can't leave, like they're stuck in sites all day long. They don't have anyone to talk to, and going to them courses will help, just even chatting and getting advice and seeing what other mums think of situations like that you might not know of. Like, I think more courses needs to be done especially for when they're younger.
The Prevention, Partnership and Family Sports Subcommittee is a subgroup of the CYPSC. It aims to implement the MEHL National Practice Model to ensure that children and young people with additional unmet needs receive early support and help in an integrated and coordinated way that is easily accessible to them. The outcomes for children and young people that the PPFS Steering Committee aims to improve primarily relate to children with additional unmet needs. We also aim to improve child and parental participation in decisions about how services are designed and delivered. Some examples to date of projects in Dún Laoghaire Rathdown are the Changing Futures website, which was developed by local young people with a lived experience of tussler services. Part of this PPFS structure is the Child and Family Support Networks, which are the basis for implementation of MEHL at local level.
There are 5 child and family support networks in the Dún Laoghaire Rathdown area. There are 3 on the east coast, so there's the Dún Laoghaire Mounttown network, there's the Ballybrack Loughlinstown network and the Shankill network. Then on the west side there are 2 networks at the moment, and they are Ballantyre Dundrum and Sandyford and Carrick Mines. And those networks bring all of the services who are operating in those areas together and offer them an opportunity to get to know all of the different services in the area. MEHL, in terms of child and family support services, is really about bringing all the different statutory, community and voluntary services together who are working with children. So where they have identified that there's unmet need for a child, they will come together and work in conjunction with the family to put a support plan in place for the family. Looking at the strengths of the child and what the needs are, and it's very much outcomes focused. You're all the time looking at what is the outcome we would like for this child or this family, what do we need to get there, and it's about putting an action plan in place so that you're taking steps towards progressing towards the national outcomes.
I'm speaking to you on behalf of Chief Superintendent Matt Nyland, who co-chairs the Safety and Protection from Harms subgroup of the Dún Laoghaire Rathdown CYPSC, along with the Tusla Principal Social Worker for Child Protection. This interagency subgroup is focused on three key issues: domestic abuse, homelessness and cyber safety. These are critical issues for the services to work together to address, to keep children and young people safe and protected from harm in their families, in our communities and online. We welcome the interagency dialogue and planning at senior management level that our CYPSC here is facilitating to secure the resources, the personnel and the programmes that are needed to protect children and young people from the significant harm that domestic abuse, homelessness and cybercrime can cause. We look forward to continuing to work with all of the stakeholders and with the CYPSC coordinator to progress and implement the county plan for Dún Laoghaire Rathdown.
One of Focus Ireland's priorities is to reduce the impact that homelessness has on children and the trauma that it can have on children. So I think engagement with the CYPSC really helps with that, because it focuses on a wide range of needs for the children, on mental health, physical health and play, on their education. And I think through that we can try and look at the needs of the children and the families we work with and try and improve that and hopefully improve their mental health, physical health and well-being, not just in childhood but throughout their lifetime.
From the programmes that we would have worked in partnership here with CYPSC coordinator Laoghaire, the outcome has been fantastic. One in particular, the Imagination Playground, really entices all the children out to the playground, and it's a really interactive piece. It's all interlocking kind of blue blocks, so it's really creative. Some of the kids who may be a little bit shy in accessing the playground, it kind of is quite inviting for parents, and so then the full family tend to come out for it when the Imagination Playground is out. So it's really great for the children for that interactive piece.
When CYPSC came on board within the catchment, we were invited to sit on the committee with multiple agencies. It gave us an opportunity to all link together and kind of identify the needs around domestic, sexual and gender-based violence. The TLC Kids programme, it's a recovery programme, and I suppose it gives them a safe space to come together with other children and other mothers, and I suppose identify how they feel, develop safety plannings and then strengthen building the bonds between the mother and child.
About 2 years ago, we put together an application through the Department of Children and Youth Affairs What Works Fund, and thankfully we were successful and received funding for a youth mental wellness project worker. So over the last 18 months or so, we've been working on a project with young people. It's about young people, about their youth mental health, and it's for young people at the heart of it at all times. Back in May then, the final step was the design of the website Let's Talk DLR. So this was a collaborative, interactive process with young people at the heart of it at all times. And the website is really informative. It's basically a signposting website with a huge amount of information about local youth mental health services in the area.
I got involved with the website because of my own experiences with mental health and the lack of supports and resources that I had, because my parents and we couldn't find them. When we went to the meeting, we realised that there were all of these supports and all of these resources out there, but we couldn't find them because we didn't know that they existed.
Finding services is extremely difficult, so we've made sure that was a main focus of the project, to have all the services in one place in an easy to understand format. I personally got involved because I found it was a very important thing for young people to have what they need, where they need it, so they don't have to go searching for hours to find the correct service.
This website developed by CYPSC has been a huge improvement on information providing services. It'll definitely be easier to navigate, it'll definitely be easier to access these services now for young people who haven't been able to find these services before. It's definitely like as us young people were asking for.
Corlin and Oak are the national recognised structure for hearing the voices of young people, and there's one in each local authority in the country, so there's 31 in total. So here in DLR we have a really well established and strong Corlin and Oak that has been operating for a number of years.
Corlin and Oak is a council of young people here in Dún Laoghaire, Rathdown. It's an opportunity for us to have our voice heard on topics that are really important to us. We get the opportunity to directly influence policies that will affect us.
At the CYPSC consultation, we were given the 5 national outcomes, and we were asked to discuss the problems and what we can do to create solutions and what young people could do.
As a member of Corlin and Oak, my voice represents 15,000 young people in DLR aged 12 to 17, and that gives me an opportunity to have my point of view heard and listened to, and my opinion, which I think is fantastic, because then I can affect change in my area and have effect on the topics of change as well.
It's been very, very important, and that interagency approach with the Gardaí, the HSE, TUSLA and all of the other agencies has been very important, and particularly looking at services for young people, for children and young people, has been hugely important, and everybody has a role to play in that. So all of these very positive and tangible projects have really, really great results, and all of that involves working with TUSLA and working with the County Council. We can't do it on our own, we can only do it in cooperation.
The need for projects and programmes is growing, and the demand is growing, and also just to point out that it's not just areas of deprivation that need support. We would get a lot of referrals from other schools around and affluent schools and what would be classed as fairly middle class, particularly around substance use, and I think that needs to be addressed, that it's universal and the supports are universal, and if we are going to be looking towards prevention and partnership, we need to consider all families of the area.
When services are thin on the ground and you're stuck in the trenches a lot of the time, it could be easy to feel a bit despondent. So coming together has been a very re-energising and invigorating experience, I think, not only for statutory service providers, but also I think for all community partners.